total contact cast used to be the golden standard to treat diabetic foot ulcer. But just imagine having a cast all the time, even sleep with it at night. That's the problem. This is 2 Minutes with Cheyenne, and I asked David how we can address that.
That's a great question, Cheyenne. I think nobody really wants to wear a cast, not only when they sleep, but during the day as well. It's uncomfortable, and it's also inconvenient, not only for the patient, but also for the clinician. It takes time to put it on, and you have to have the right resources to do it, and it's error-prone as well. So what we have developed is a system that allows a layer of freedom for the patient, right? This is the Defender Smart Boot, powered by Sensoria. You actually see here that is removable. So when the patient goes to sleep or needs to go to the bathroom or needs to go and take a shower, he can probably remove it if the doctor said it was okay to do that.
So it is very easily...
Super easy to put on, Velcroed on. It has been designed by the same designer that designed the Nike Air Jordan.
Oh, wow. It looks very cozy.
Mike Pitulio, yeah. And so what we did was we actually apply a sensor to it, and we provide the patient with a watch so that not only the patient can know what to do and when to do it, but we actually drive all this data to the cloud so the doctor knows which patients are adhering to the mechanically offloading protocol and which ones they need to call back and have a conversation with, saying, why are you removing the boot? If they're unable to comply, this boot can be made non-removable. And so at that point, it behaves like a total contact cast.
Excellent. So it brings comfort to the patient side, necessary information to the clinician side to do it. So I have a question. While you get all this data, probably the physician doesn't need to go all the time to check it. If someone is not wearing it, you can alert them to make that process more efficient.
Absolutely,
right?
Absolutely. So you have a medical assistant or a nurse, 7 o'clock in the morning, 7 o'clock at night. They can actually take a look at the dashboard. We call it the traffic light approach.
Okay.
It's red, yellow, and green. The machine is basically telling the clinician which patients need more attention.
Great. So is it something patients can purchase direct to consumer, or it goes through doctor?
Yeah, so both ways. The Defender boot is on Amazon right now, not the smart version though. The smart version, of course, needs to be prescribed by a podiatrist or a clinician.
Insurance pays for this?
Yeah, there is an L code that can potentially be used for this boot. There are CPT codes for remote patient monitoring. And there are also MIPS, quality of care incentives as well. So 3 layers of reimbursement.
And does this need FDA approval? Or
it's a class 1. It's a class 1, FDA.
Coming up with the innovation to make something working is one thing. Find all these relative codes and payments and who pays for it is I would say, more difficult part to do. And congratulations, you have done both. What I understood is you can embed these sensors in other products too. Would you like to quickly touch on that too?
Sure. Our goal is to build a full platform that turns footwear into services. Okay. We call it footwear as a service platform. FAS.
Wow.
So as an example here, you see one of our socks. This is a smart sock. We have textile pressure sensors embedded into the sock.
The sensor is here. Probably we get it here. Yep. People can see. Okay.
And this is a 9-axis IMU. So we have both an accelerometer and a gyroscope, and also a magnetometer in this little device here, which we call Sensoria Core.
Awesome.
And in the sock, you actually have the textile pressure sensors. So this is actually an extension of a gait lab system, if you will.
Oh,
so we can see not only how many steps a patient is taking, but how well is he walking today.
This is precision walk, I guess, technology. Everyone can use this. So thank you very much.
Thank you.
Check out sensoria.com for more information.
Sensoriahealth.com.
Sensoriahealth.com.
Yes.
Thank you.